Wastewater surveillance, the process of tracking disease by testing wastewater, gained momentum during the COVID-19 pandemic when it was used to help track the spread of the virus driving that pandemic, SARS-CoV-2. Local and state governments used this testing to assess trends in COVID-19 infections over time. A single wastewater sample provides insight into the health of an entire community, making this tool both cost-effective and great at catching what clinical testing may miss because of people unwilling or unable to test. Wastewater surveillance has been particularly impactful as more and more people switch over to using at-home rapid tests, the results of which are not captured by public health surveillance. Wastewater surveillance can act as an early warning system, as it can detect diseases and changes in disease trends before they appear in clinical cases. This early warning improved public health emergency responses to viruses like bird flu, Mpox, and hepatitis A. Public health officials used wastewater testing to create a kind of smoke alarm, alerting health officials to the presence of the virus in their region. This warning enabled local leaders to coordinate with clinical health care, effectively allocate resources, and inform community public health action. The widespread use of wastewater surveillance across the U.S. during the COVID-19 pandemic led to the creation of national platforms like the CDC's National Wastewater Surveillance System, or NEWS. The system supports state and local wastewater surveillance programs around the country and makes their data available on a public online dashboard. And this system has continuously developed and grown over the past few years. Since its inception, the National Wastewater Surveillance System has increased from covering less than 1% of the U.S. population to now covering nearly 50%. Complementing this federal effort is Wastewater Scan, a collaboration between Stanford and Emory universities. Wastewater Scan monitors more than a dozen viruses, providing consistent, frequent monitoring for pathogens like norovirus, hepatitis A, and most recently, measles. Data demonstrate that we can detect measles in wastewater before clinical cases appear in a community, which makes wastewater surveillance a powerful tool in curbing the virus's spread. In Idaho, measles was detected in local wastewater an entire week before the state had its first confirmed case in more than 20 years. Early warnings like this give public health officials a chance to act quickly and can help prevent small outbreaks from growing into something much larger. Wastewater Scan does share a subset of its data with the National Wastewater Surveillance System, so its coverage, about 12% of the U.S. population, is included in the NEWS totals, but only for pathogens that the CDC actively reports publicly. The National Wastewater Surveillance System also recently started tracking measles in wastewater. Currently, the National Wastewater Surveillance System is active in all 50 states as an effective early warning system with tremendous potential. To fully realize its potential, two areas need additional focus. The first is surveillance coverage for different pathogens. Since 2020, the National Wastewater Surveillance System has expanded to monitor other pathogens like flu A, bird flu, Mpox, RSV, and measles. Yet decisions about which pathogens to monitor are left up to individual sites. This voluntary approach limits the national picture we can build for different pathogens and creates inconsistencies in our surveillance. To get the most from wastewater surveillance, we should be maximizing testing for multiple pathogens at all sites. The second area that requires additional focus, the entire system relies on supplemental COVID-era funding, and this money is running out. Very limited funding will carry into the next fiscal year. Without more permanent federal investment, we risk losing the progress we've made in the warning system we've built. We've created a sophisticated smoke alarm system in wastewater surveillance, but we are failing to use it to its full potential. This tool has proven to be a powerful way to predict and respond to deadly diseases. Wastewater surveillance gives us actionable data that public health departments desperately need. Now is the time for permanent funding and expansion.